Hey everyone, welcome back to our channel where we break down medical stuff in plain, simple English. If you've heard of RSV and wondered, wait, what exactly is that? You're in the right place. Stick around for the next few minutes and I'll explain it like we're chatting over coffee, no medical degree required. And hey, if you like learning about health the easy way, hit that subscribe button and ring the bell so you never miss a video. Alright, let's start with the basics. RSV stands for Respiratory Syncytial Virus. Sounds fancy, right? But it's actually a common virus that affects your lungs and breathing passages, aka your respiratory system. Now here's the wild part. Most people get RSV at least once by the time they turn 2 years old. Yup, it's that common. In fact, it's one of the top causes of bronchiolitis and pneumonia in babies. But don't be fooled, RSV doesn't just affect kids. It can also be serious for older adults, people with weakened immune systems, and those with chronic heart or lung diseases. For most healthy people, RSV feels like a regular cold, runny nose, a little cough, maybe a mild fever. But for others, it can lead to more serious breathing problems. So where does RSV come from? It's a virus, meaning it's not something you catch from food or water, but from people who are already infected. The virus spreads through coughing or sneezing, tiny droplets flying through the air, touching contaminated surfaces like doorknobs or toys, close contact, especially in places like daycares or nursing homes. Basically, it spreads the same way a cold or flu does. You can touch a surface with the virus, then rub your eyes or nose, and boom, your body becomes RSV's new home. It's especially active during fall and winter, which is why RSV outbreaks tend to spike in those seasons. Now, who is at risk? Great question. Let's break it down. Babies, especially those under 6 months or born prematurely. Older adults, usually over 65. People with heart or lung conditions. People with weakened immune systems, like those going through cancer treatment. In babies, RSV can make it hard to breathe or even cause wheezing. In older folks, it might look like a bad cold at first, but it can lead to serious lung infections like pneumonia. And sometimes, people don't even know they have RSV. They just think it's a cold, and they unintentionally pass it on to someone more vulnerable. Let's talk symptoms of RSV. For most people, they show up 4 to 6 days after infection and can include runny nose, sneezing, mild headache, cough, fever, decreased appetite, wheezing in more severe cases, trouble breathing, especially in infants or the elderly. In babies, symptoms can be sneaky. Sometimes they just seem tired, irritable, or stop feeding well. So it's really important for parents to keep a close eye on those subtle changes. So you might be wondering, if it's just a cold, why all the fuss? Well, for most people, RSV is nothing more than a mild annoyance. But for some, it can land them in the hospital. Every year, RSV leads to millions of infections and hundreds of thousands of hospitalizations worldwide. It's also one of the leading causes of respiratory illness in infants, and that's why doctors and researchers pay close attention to it. So now you know, RSV is a common virus, super contagious, and can be a big deal for certain people. The more you understand it, the better you can help protect yourself and your loved ones. Want more easy-to-understand breakdowns of diseases like this? Then please subscribe to the channel, hit that like button, and drop a comment if there's a condition you want us to cover next. Thanks for watching, and stay healthy out there.